Hepatitis C is a viral infection that specifically targets the liver, an organ that plays a crucial role in keeping your body healthy and balanced. This virus is known as HCV, and it can have a profound impact on your overall well-being if left untreated. The liver is one of the body's most vital organs, responsible for hundreds of essential functions that keep us alive and thriving. Acting as your body's main filter, the liver cleans your blood by removing toxins, helps digest food by producing bile, and stores energy in the form of glycogen. It also helps regulate cholesterol, supports your immune system, and even helps your body process medications. When the hepatitis C virus, or HCV, infects the liver, it causes inflammation, disrupting these essential functions and putting your health at risk. Over time, this inflammation can lead to scarring, known as fibrosis, and eventually to more serious conditions like cirrhosis or even liver cancer. The term hepatitis simply means inflammation of the liver, but the causes and consequences can vary widely. There are several types of hepatitis viruses, A, B, C, D, and E, each with its own unique traits, methods of transmission, and health risks. Some are spread through contaminated food or water, while others, like hepatitis C, are most often transmitted through blood-to-blood contact. Hepatitis C stands out because it often becomes a chronic, long-term infection. Unlike some other forms of hepatitis, it rarely causes symptoms in the early stages, which means many people don't realize they're infected until years later. Unlike hepatitis A, which usually clears on its own after a short illness, hepatitis C can persist in the body for decades if not treated, quietly causing damage. Hepatitis C can linger for years, silently damaging the liver and increasing the risk of serious complications like liver failure or cancer. This is why it's often called a silent disease. Most people don't notice any symptoms when first infected, so they may continue with their daily lives completely unaware that their liver is under attack. This means many live for years without knowing they have it, potentially spreading the virus to others and missing the chance for early treatment. All the while, the virus slowly harms their liver, making early detection and intervention critical for long-term health. That's why awareness and regular testing are so important, especially for people who may be at higher risk due to past medical procedures, blood transfusions, or sharing needles. It's important to remember that hepatitis C isn't a bacterial infection, so antibiotics, which are designed to fight bacteria, won't work against it. Instead, hepatitis C requires targeted antiviral treatment which is specifically designed to attack the virus and stop it from multiplying in your body. The good news? Thanks to major medical advances in recent years, we now have highly effective ways to diagnose, treat, and even cure hepatitis C. Modern antiviral medications can clear the virus from your body in just a few months for most people. With proper treatment, the vast majority of people with hepatitis C can go on to live healthy, full lives, free from the virus and its complications. Understanding this virus is the first step to protecting yourself and those around you. By staying informed, you can help reduce stigma, encourage others to get tested, and support those who are undergoing treatment. By learning about hepatitis C, you empower yourself to take control of your health, make informed choices, and contribute to a healthier community for everyone. Hepatitis C spreads through blood-to-blood contact. You can't catch it from hugging, sharing food, or casual contact. It's not airborne or spread through saliva. The main risk is sharing needles or equipment for injecting drugs. Before 1992, contaminated blood transfusions were a common source, but today, blood supplies are screened and safe. Other risks include unsterile tattoo or piercing equipment, accidental needle sticks in healthcare, and rarely from mother to baby during childbirth. Sharing personal items like razors or toothbrushes can also pose a risk, though it's less common. Sexual transmission is possible, but much less likely than with other viruses like HIV. Understanding these routes helps reduce stigma and focus prevention where it matters. Knowing how hepatitis C spreads is key to stopping new infections. Most people with hepatitis C don't notice any symptoms, especially early on. This is why it's often called a silent infection. People can go about their daily routines, working, spending time with family, or socializing with friends without realizing anything is wrong. The virus quietly settles in, and the body gives few, if any, warning signs. In fact, over 75% of newly infected people feel completely normal. They look and act healthy, with no outward signs of illness. This makes it easy for hepatitis C to go unnoticed, sometimes for years or even decades. If symptoms do appear, they're often so mild that people dismiss them. You might feel a bit more tired than usual, have some joint pain, mild nausea, or just a vague sense of feeling unwell. These symptoms are easy to overlook or blame on a busy lifestyle, stress, or aging. Rarely people develop jaundice, where the skin and eyes turn yellow, or notice dark urine and pale stools. These are more obvious signs that something is wrong with the liver, but they don't happen to most people with new infections. These signs are classic for liver trouble but are uncommon in acute hepatitis C. Most people never see these warning signs until the infection has already caused significant damage. As the virus quietly becomes chronic, people continue living their lives, unaware that their liver is slowly being affected. The infection can persist for years without any clear symptoms. Even in the chronic phase, symptoms are subtle: persistent tiredness, brain fog, or mood changes. These can be mistaken for everyday stress, lack of sleep, or other common problems. By the time symptoms are obvious, significant liver damage may have already occurred. This is why hepatitis C is so dangerous. It can silently harm the liver for years before anyone realizes. That's why routine testing is so important. A simple blood test can detect hepatitis C before it causes serious problems, even if you feel perfectly healthy. Hepatitis C is often silent, but its effects can be serious if left unchecked. Early detection through testing is the best way to protect your health and prevent long-term liver damage. The real danger of hepatitis C lies in its ability to silently become a lifelong chronic infection. Many people who contract the virus don't even realize they have it because symptoms can be mild or absent for years. This means the disease can quietly progress, causing damage without any warning signs. Most people don't clear the virus on their own, so it keeps attacking the liver for years, sometimes even decades. The immune system tries to fight the infection, but the virus is persistent, leading to ongoing injury to liver cells. This ongoing inflammation leads to scarring, called fibrosis. Fibrosis is the body's attempt to heal itself, but over time, too much scar tissue builds up and starts to interfere with the liver's normal function. As the years go by, scar tissue accumulates, making the liver stiff and less effective at filtering toxins, processing nutrients, and supporting digestion. The liver's ability to regenerate is overwhelmed by the constant damage. Severe scarring results in cirrhosis, a condition where the liver's structure and function are permanently damaged. Cirrhosis is a serious, life-altering disease that can affect nearly every part of the body. Cirrhosis can cause a range of complications, including fluid buildup in the abdomen, internal bleeding, confusion due to toxins in the brain, and even complete liver failure. These complications can be life-threatening and often require urgent medical care. People with cirrhosis are also at much higher risk for developing liver cancer, which is often difficult to treat and can be fatal if not caught early. Once the liver fails, a transplant is the only option for survival. Liver transplants are major surgeries with long recovery times and are not always available to everyone who needs them. That's why early detection and treatment are absolutely critical. Simple blood tests can identify hepatitis C before it causes serious harm, allowing for timely intervention. Chronic hepatitis C is a serious disease, but the good news is that it's both preventable and treatable. Modern medications can cure most people, stopping the virus before it causes lasting damage. Acting early can save lives, prevent irreversible liver damage, and offer hope for a healthy future. Don't wait. Get tested and talk to your doctor about your risk. Diagnosing hepatitis C is straightforward and starts with a blood test. Most people are tested because of risk factors, not symptoms. Health organizations recommend everyone get tested at least once, especially those with higher risk. The first test looks for antibodies to the virus, evidence you've been exposed. If positive, a second test checks for the virus's genetic material to confirm an active infection. If the virus is present, further tests assess liver health and damage. These may include blood tests and imaging like FibroScan, which measures liver stiffness. Liver biopsies are now rare thanks to advanced non-invasive tests. Early diagnosis is key to effective treatment and better outcomes. Simple testing can reveal a hidden infection before it causes harm. Treating hepatitis C today is easier and more effective than ever. Gone are the days of year-long injections with harsh side effects. Now, direct-acting antivirals, simple daily pills, can cure over 95% of cases in just 8 to 12 weeks. These medications target the virus directly, stopping it from multiplying. Side effects are usually mild, and most people feel little to none. The cure is defined as having no detectable virus 12 weeks after treatment. These treatments work for nearly everyone, even those with advanced liver disease. Hepatitis C is now a curable disease for almost all who seek treatment. There's no vaccine for hepatitis C, so prevention is all about avoiding exposure to infected blood. Never share needles or drug equipment, the leading cause of new infections. Use sterile equipment for tattoos and piercings, and choose reputable licensed providers. Don't share personal items like razors or toothbrushes that might have blood on them. Practice safer sex, especially if there's a risk of blood exposure. Syringe exchange programs can provide clean equipment and safe disposal. Ask about sterilization procedures before any procedure involving needles. Each person should have their own grooming tools at home. Simple precautions can dramatically reduce your risk. Prevention starts with knowledge and smart choices. Curing hepatitis C is a life-changing milestone. Once the virus is gone, liver inflammation stops and many people feel more energetic and healthy. If treatment happens before major scarring, the liver can often heal completely. Even with some fibrosis, the liver can improve over time. However, cirrhosis is permanent. Those with advanced damage need ongoing care and regular cancer screening. Being cured doesn't make you immune. You can get hepatitis C again if re-exposed. Prevention remains important even after a cure. Early treatment leads to the best outcomes and a healthier future. Life after hepatitis C is a new beginning, but vigilance is still needed. Hepatitis C was once a silent epidemic, but today knowledge is our best defense. We have the tools to find, treat, and cure this disease. The biggest barrier now is lack of awareness, not lack of medicine. Understanding how hepatitis C spreads and the importance of testing can save lives. Encourage friends and family to get tested, especially those at higher risk. The cure is simple and effective. No one should suffer needlessly. Public health efforts and personal conversations both matter. By learning and sharing this information, you help end the stigma and stop the spread. Take charge of your health and support others to do the same. Together, we can make hepatitis C a disease of the past.